It all started when we were first coming here and trying to do as many surgical procedures on children or adults as they needed us as possible.
I think my motivation for being a doctor, going to the profession, is all because of growing up as a kid.
The 2014 Humanity First USA team, comprised of 10 individuals from diverse backgrounds, were in Ghana and Liberia for 2 weeks of March. The team initially performed a 2-day training course in Accra.
The Humanity First USA surgical training team arrived in Accra, Ghana last night, and today the 9 team members who are from all across the United States and one is from Saudi Arabia began the laparoscopy course.
Humanity First has offered a very unique opportunity for a good number of doctors and nurses this time to actively take part in a course that gave us a lot of skills within a very short time.
It's a 2-day course, and in the course for the first day there's a lecture component as well as surgical skills stations where we teach the local surgeons and nurses how to improve their dexterity.
That's the first time they are getting contact with laparoscopic equipment. So for example, my nurses who came with me are seeing laparoscopic equipment for the first time, so it's a good exposure.
Basically, what happens is that as a resident we learned, medicine, 21st century medicine, but you go back and due to lack of maybe further training and equipment, we go back to 19th century medicine.
Humanity First's approach is one that focuses on empowering the people of the world to help themselves by giving them the tools and knowledge to improve their own health and the health of their own communities.
Doctors at home have been trying their best so far, at least striving to offer some degree of care in whichever way possible. Despite the limited resources available, we just strive to do what we can to help out the patients. The Humanity First initiative is actually a good one because now I feel it helps us broaden our knowledge, improve our skill acquisition opportunities, and of course that translates to better quality of care that we can offer people out there.
It's helpful. I think it's going to help us help our surgeons assess them, and then help our patients too. Because when we do open surgeries here, the patients take a longer time or a long period in the hospital, and then for them to go home is cost effective.
Humanity First began their operations in Liberia in 2012. Some of these operations include a vocational college, teaching the youth skills to obtain jobs, a cassava processing plant, and annual surgical missions. With the same common goal of educating local physicians, the Humanity First team began their surgical hernia course at Tapita Hospital in Liberia.
I think the good thing about it is that the hospital, when it was built, yes, indeed, you had equipment and so forth, but equipment alone cannot do it. You need trained manpower, and with building capacity, this is where Humanity First has come. I benefited from a training that was conducted at Phoebe Hospital in mesh repairs of hernias, and because of the way the training was conducted and so forth, I invited, Dr. Fizan Abdullah and his team over here. When you introduce a kid to a new toy, and there's a better grade comes out, he always wants to go to the higher up. So I think we have a CT scan, we're looking for an MRI, and looking for other things in order to make our life easier. So there is a need for continuous support to this institution in terms of mesh, and sutures, gloves. I mean, things that are taken for common in the United States, you know.
So we'll start with you first, but that doesn't mean that, so the rest of us will watch as well, because the errors that I've seen over the last few years are the same errors everywhere. So if we can avoid those, it'll be easy to take care of. Okay?
We are doing an inguinal hernia course by using mesh. The prevalence of inguinal hernias in this area is very high, and the mesh is not a very popular means of surgical repair, so we introduced that here, and we are teaching them how to perform hernia repairs with mesh.
We've read about mesh procedure before, but we've not seen one perform. Now coming to see it and how it's done, at least it gives you an idea of, you have read it before and you have seen it, so you have a better picture of what it is. Like you can be confident that I've done this before, I've seen this done before, so you can do it.
Looking at Africa today, the trend we have taken is important that these NGOs and humanitarian groups come, because it means a lot to us. It helps our political system, it helps our educational system, as well as our health system. So Humanity First is contributing a lot to Africa, and it's going to change Africa for 30 years to come.
I must take this opportunity to thank Humanity First for a very wonderful, thought-provoking initiative that they took to help reach this lack of knowledge and skills in our part of the world.
I want to take this time to appreciate the team and to continue this, because especially in Africa, since we have a lot of limitations, it helps us a lot. We will have a reduction in our hernia recurrence once we get to practice the mesh technique, and we can better help our patients in that way. So I appreciate it a whole lot, and I hope it continues from me.
I must say that I'm going to Google out Humanity First. I would even offer myself as a volunteer, and I think I would never miss an opportunity in the future if one ever comes up to participate in any program organized by Humanity First.
You can contribute and make a difference in these countries by donating. For more information, visit humanityfirst.org.